Equine colic, a management approach. What is colic? Colic is most simply defined as abdominal pain, with no indications as to the cause of the pain. In reality, colic remains one of the #1 causes of death in horses in America, a very real health and financial concern to horse enthusiasts and owners. Colic cases include those caused by gas, impactions of the intestinal tract, torsions or twists in the digestive tract, and those caused by ingestion of foreign bodies. Signs of colic can include, but are not limited to, repeated laying and standing in an attempt to get comfortable, biting at or staring at the sides of the abdomen, rolling or thrashing, profuse sweating, rapid heart rate, rapid respiratory rate, and a reduction or absence of fecal matter being produced. Whatever the signs, if you suspect your horse may be experiencing colic, you should always treat it as an emergency and contact your veterinarian. Time lost can ultimately result in life lost. Colic diagnosis and proper treatment need to be done as quickly as possible to save your horse. How is colic prevented? To understand how to prevent colic, it's important to understand some of the causes of colic. Underlying causes can be related to medical causes, such as illness or disease, injury, or they can be management-related. It is these management-related causes that we will discuss in the following slides. Remember, if you prevent the causes that you are able to affect, you are more likely to prevent the colic. Strong management practices are key to preventing and minimizing the chances of management-related colics. Feed is one of the main management concerns related to colic. The type of roughage or hay that a horse eats can directly influence the likelihood of developing colic. Hay that is poor quality and unbalanced in its nutritional profiles can cause digestive upset. Enteroliths, stones that form in the intestines, can be linked to feed with an overbalance of different minerals in them. These minerals collect in the intestines and form stones, some of which have been recorded to weigh between 10 and 15 pounds. If you are feeding more grain than hay, then you are increasing your horse's chances of developing colic. The digestive tract of horses is physiologically designed to handle roughage more than grain-based feeds. Ensure that you are feeding no more than 1% of a horse's body weight in grain-based feeds, with the other 1% at least being obtained by eating roughage. If you are changing your horse's diet for any reason, ensure that it is not a sudden change. Slowly introduce new foods over the span of 7 days, and observe your horse for signs of discomfort during this time. Is your horse ground-fed? Did you know that feeding on the ground in a dirt lot causes the ingestion of large amounts of soil and possibly sand? Sand accumulation in horses can lead to colics that range from mild to life-threatening. It is easily solved by feeding your horses in a feeder and minimizing the amount of feed that they ingest from the ground. Additionally, do you know the content of the soil that your horse is eating off of? Soil can contain bacteria, fungi, and toxins that can easily leach into your horse's feed and poison your horse. Foreign materials, such as small rocks, mosses, or the like, can accumulate in the digestive tract as well and cause impactions and pain. Parasites are also a major concern in colic. For some time it was common practice just to rotate dewormers depending on your location and the time of year. While this practice held true for that time, it is possible now that parasites are not being effectively treated, and this can easily lead to parasites becoming resistant to the dewormers that are being used. Fecal ova counts can not only identify the specific type of worm and the right medications to treat it, but also identify how heavy of a worm load your horse may have. Remember that horses with a heavy worm load should be dewormed under the supervision of a veterinarian. Too rapid of a deworming protocol can cause intestines to become clogged up with dead worms, also leading to colic. Water is an often underestimated cause of management and colic in horses. Water is the most essential nutrient of life and must be maintained in proper amounts. It lubricates the ingesta while it travels through the digestive tract, ensuring that it doesn't get compacted and stuck while moving. It replenishes water losses that occur during sweating and creating urine. It also helps maintain healthy blood pressure. Changes in water intake can put a horse at significant risk for colic, and the reason for these changes can be many. External temperature can cause a need for more water or increase water loss. Water temperature itself can cause a horse to either drink more water than needed or refuse to drink at all. Water that is obtained through city water systems, and sometimes wells, can be contaminated with ingredients that cause horses to refuse to drink at all. Additionally, humans can inadvertently impose water restrictions on their horses without knowing it. Travel, exercise changes, shows, and trials are all examples of ways horses can be restricted from water and have their chances of colic increase. Can you imagine trying to swallow food that you are only able to chew once or twice? Improper dental health can put your horse into a very similar situation. Horses spend a good amount of time chewing their food and breaking it down into smaller pieces for easy digestion. If a horse's teeth have not been well cared for, or if they are broken and in need of extraction, they are less likely to chew their food properly before swallowing. Older horses who may be missing teeth may be unable to properly chew their food. Teeth should be floated on a regular basis. Ensure that a dental check is performed by your veterinarian at least once a year along with a wellness exam. Additionally, you can notice problems starting early if you observe your horse for signs of quitting. Excess food or food bits being left after they eat, or a refusal to eat any portion of their food should warrant extra attention to their teeth and possibly a call to your veterinarian. Local flora in your horse's pasture or within eating reach of your horses while out on trail can also lead to cases of colic. Not all foods a horse will eat are nutritionally appropriate for them to eat. Many plants are also very toxic to horses and can not only cause colic but also life-threatening if they're eaten. The list of plants on this slide represents the top 10 most poisonous plants as determined by the editors at Equus magazine and should not be considered all-inclusive. If you are concerned about a possible poisonous plant on your property, you should contact your veterinarian or the ASPCA Animal Poison Control Hotline for more information. Please prevent your horse from eating any plants that you aren't 100% certain are safe to eat. Colic can also be caused by the use of certain medications. Nonsteroidal anti-inflammatories such as Banamine and Bute are commonplace in stables and have a fairly common rate of use outside of a veterinarian's recommendations. Long-term NSAID use can lower the body's abilities to protect itself, can lead to gastric ulcers, and ultimately to colic. One of the most common side effects of opioids, such as morphine or buprenorphine, is decreased gut motility, meaning that food in the gut takes longer to move through the intestines. Use of ophthalmic atropine can decrease the secretions in the digestive tract, drying out the ingesta and making it easier for it to become stuck as it passes through. Lastly, antibiotics can alter the population of bacteria in the gut and in the cecum, which will change how the digestive tract functions and can cause gas accumulation and possible colic. It is important not to use pharmaceuticals without the direction of your veterinarian, and also important that you understand all of the possible side effects of any medications your veterinarian recommends. If your horse is taking any of these medications, be extra observant for small signs of colic and call your veterinarian immediately if any are observed. Do you travel a lot with your horses? Be aware that travel can greatly increase your horse's risk of colic. Travel induces stress, causes a change in routine, and as such, a change in how much water and feed your horse takes in. Traveling can also cause a sudden change in the type of diet. To minimize the risks of colic caused by travel, horse owners should always bring enough of their home feed with them and not rely on being able to obtain the same feed in a different location. Plenty of fresh, clean water should be provided both during travel and after reaching the destination. Additionally, owners should take care to make sure that travel is as quiet and calm as possible, taking breaks when needed and allowing a horse time outside the trailer when it is safe to do so. Allow your horse to acclimate properly to travel and to their new location prior to packing them up and moving again. Lastly, stress can be a major contributing factor to a horse developing colic. Stress causes horses to refuse or decrease their water intake. It can cause a horse to increase or decrease the amount of feed they will eat. Stress can increase a horse's body temperature, cause them to sweat, and increase water losses in the body. Remember, too, that stress can be caused by illnesses, disease, surgery, exercise routines, new horses being brought in, pregnancy and breeding, competition for food or for anything with other horses, and the weather. Being aware of what stresses your horse can help you identify the sources of these stresses and prevent them from affecting your horse adversely. This can help prevent against colics caused by those stresses.